detailed explanation of Olmesartan, Olmesartan Medoxamil, suitable for pharmacology, nursing, or medical reference. I'll expand each section thoroughly and organize it for clarity. Olmesartan, complete drug monograph. Generic name, drug class, brand name, and drug forms. Generic name, Olmesartan Medoxamil. Drug class, angiotensin II receptor blocker. Pharmacologic class, renin-angiotensin-aldosterone system, RAS. Inhibitor, therapeutic class, antihypertensive. Brand names varies by region. Benicar, US. Olmetec, Canada, Europe. Olmesar, Olsar, WinBP, Olvance, Asia. Available forms, tablets, 5 milligrams, 10 milligrams, 20 milligrams, and 40 milligrams. Combination forms, Olmesartan plus hydrochlorothiazide, Benicar HCT, Olmesartan plus amlodipine, Sevicar. 2. Definition. Olmesartan is an oral antihypertensive agent belonging to the angiotensin II receptor blocker ARB class. It lowers blood pressure by selectively blocking the binding of angiotensin II, a potent vasoconstrictor, to the AT-ween receptor in vascular smooth muscle and adrenal gland tissues, preventing vasoconstriction and aldosterone secretion. This relaxation of blood vessels results in reduced systemic vascular resistance, decreased blood pressure, and reduced cardiac workload. Mechanism of action, MOA. Olmesartan is a prodrug, Olmesartan Medoxamil, that is hydrolyzed in the intestinal wall to its active metabolite, Olmesartan. Angiotensin II acts via two receptor subtypes, AT-ween receptors, responsible for vasoconstriction, aldosterone release, sodium retention, and sympathetic activation. AT2 receptors mediate vasodilation and antiproliferation, less clinically significant. Olmesartan selectively blocks AT-ween receptors, leading to 1. Vasodilation, decreased total peripheral resistance and blood pressure. 2. Reduced aldosterone secretion, less sodium and water retention, lowering blood volume. 3. Decreased sympathetic activity, contributing to reduced cardiac afterload. Unlike ACE inhibitors, it does not inhibit bradykinin breakdown, so dry cough and angioedema are rare. 4. Pharmacokinetics, parameter description, absorption, rapidly absorbed, prodrug converted to active olmesartan in intestinal mucosa and portal blood. Bioavailability, approx 26%, time to peak plasma level, Tmax, 1 to 2 hours post-dose. Distribution, volume of distribution 17-elf, 99% plasma protein bound, mainly to albumin. Metabolism, not significantly metabolized by the cytochrome P450 system, low drug-drug interaction potential. Elimination half-life TNAF, 10 to 15 hours, allowing once daily dosing. Excretion, 35 to 50% in urine, unchanged. Remainder via feces, biliary route. Steady state, achieved within 3 to 5 days of daily dosing. HANA 5 uses. Primary use, management of essential hypertension, high blood pressure in adults and children aged 6 years and older. Off-label, adjunctive uses, heart failure when ACE inhibitors are not tolerated, chronic kidney disease and diabetic nephropathy, renal protection, left ventricular hypertrophy management to prevent cardiac remodeling. 6. Indications, approved indications, treatment of primary essential hypertension may be used alone or in combination with other antihypertensive agents such as thiazide diuretics, e.g. hydrochlorothiazide, calcium channel blockers, e.g. amlodipine. 7. Contraindications, absolute contraindications. 1. Hypersensitivity to olmesartan or any excipient in the formulation. 2. Pregnancy. Contraindicated in second and third trimesters, category D, may cause fetal toxicity, renal failure, or death. 3. Severe renal impairment, CarCl 30 milliliters per min, or biliary obstruction. 4. Co-administration with aliskiren in patients with diabetes mellitus, risk of renal impairment, hypertension, hyperkalemia. Relative contraindications, volume or salt depletion, risk of symptomatic hypertension, bilateral renal artery stenosis, hyperkalemia. 8. Precautions before taking olmesartan. Inform your doctor if you have kidney or liver disease, are on a low salt or potassium-rich diet, have congestive heart failure, are taking NSAIDs, lithium, or potassium-sparing diuretics, are pregnant, planning pregnancy, or breastfeeding, have persistent diarrhea or weight loss, may indicate sprue-like enteropathy. Pregnancy warning. Drugs acting on the RAS system can cause fetal injury and death. If pregnancy occurs, discontinue immediately. 9. How to use. Take orally once daily with or without food. Try to take it at the same time each day. Swallow the tablet whole with a full glass of water. Continue taking it even if you feel well. Hypertension often has no symptoms. Do not crush or chew unless prescribed otherwise. Macshaba 10. Dosing information. Adults 18 years. Initial dose 20 milligrams once daily. Maintenance dose 20 to 40 milligrams once daily. Maximum dose 40 milligrams per day. Adjust dose every 2 to 4 weeks based on blood pressure response. Pediatric 6 to 16 years. 35 kilograms 10 to 20 milligrams once daily. Pusher 35 kilograms 20 to 40 milligrams once daily. Elderly patients. Usually no dose adjustment is required, but monitor renal function. Renal or hepatic impairment, mild moderate impairment, use lower starting dose 10 to 20 milligrams per day. Severe impairment, avoid use. Number 11, missed dose and overdose. Missed dose, take as soon as remembered. If it's close to your next dose, skip the missed one. Do not double dose to compensate. Overdose symptoms, marked hypotension, very low blood pressure, dizziness, fainting, rapid or slow heartbeat, possible renal impairment. Management, supportive care, IV fluids, monitor blood pressure and electrolytes. Hemodialysis is not effective, high protein binding. 12. Stop or avoid taking. Stop or avoid taking if pregnancy occurs due to fetal toxicity. You develop severe diarrhea, weight loss, or intestinal symptoms, possible sprue-like enteropathy. You experience angioedema, facial lip swelling. Your doctor identifies severe renal dysfunction or hyperkalemia. Do not stop suddenly without medical advice, can cause rebound hypertension. Measure 13 side effects, common to 10%, less common, serious. Dizziness, fatigue, hypotension, low BP, headache, hyperkalemia, high potassium, back pain, renal impairment, nausea, syncope, fainting, diarrhea, sprue-like enteropathy, chronic diarrhea, weight loss, upper respiratory infection, angioedema, swelling of face, lips, tongue, sprue-like enteropathy, rare but serious adverse effect associated with Olmesartan, characterized by chronic diarrhea, malabsorption, and significant weight loss, even years after starting the drug. Now 14. Vital information for patients. Blood pressure monitoring. Regular checks are essential. Kidney function and electrolyte tests. Periodically monitor serum creatinine, BUN, and potassium levels. Hydration. Avoid dehydration, may cause hypotension or renal issues. Avoid potassium-rich foods, supplements unless advised, risk of hyperkalemia. Pregnancy must be discontinued immediately if detected. Do not share medication even if another person has similar symptoms. 15. Drug interactions. Interacting drug class, effect, concern, NSAIDs, e.g. ibuprofen, naproxen, may reduce antihypertensive effect, risk of renal impairment. Potassium-sparing diuretics, spironolactone amiloride, hyperkalemia risk. Potassium supplements, salt substitutes, hyperkalemia risk. Lithium, increased serum lithium levels, possible toxicity. Aliskiren, avoid combination in diabetes or renal impairment. Other antihypertensives, ACE inhibitors, diuretics, additive blood pressure lowering effect. Colcevalum, bile acid sequestrant, reduces olmesartan absorption, take olmesartan 4 hours before. Summary chart, category details. Generic name, olmesartan medoxamil. Drug class, angiotensin II receptor blocker, ARB. Mechanism, blocks AT1 receptors, vasodilation, and BP. Primary use, hypertension. Route form, oral tablet, 5 to 40 milligrams. Common side effects, dizziness, headache, fatigue, diarrhea. Serious effects, sprue-like enteropathy, angioedema, renal failure. Pregnancy, contraindicated, category D. Half-life, 13 hours. Elimination, renal and fecal. Key interaction, NSAIDs, lithium, potassium supplements. Would you like me to turn this into a formatted PDF or Word study? Thank you. Have a nice day.